Hi, I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and welcome to our Wednesday noon show again. And today I'm going to talk about our Secret RF, Ultherapy, and of course I always talk about skincare, so we're going to talk about that too. I had Ultherapy, actually Hydrafacial, and Secret RF last Wednesday. We had a little technical difficulty, so we actually lost the videos, but that's okay. We'll do it again at some point. And I know we've done Ultherapy videos in the past, so it was actually probably good. You didn't see me being, tortured. Ha, just kidding. So what I did to start with, I actually started with Hydrafacial, and Hydrafacial is excellent for hydrating the skin is obviously the main goal of it, but it does exfoliation, does a little mini chemical peel, and then hydrates. So I decided to try that prior to the Ultherapy just to see if that would change the results at all. I mean, I love the way Hydrafacial feels, and as I said, I was nice and hydrated before starting. Now, Ultherapy, I do it every single year. This was the first time that I have done it in 6 months. I usually do it on like every 12 months, but I wanted to see at 6 months if it really made a difference. So Ultherapy stimulates collagen, and it can go a little deeper than, say, our microneedling or our laser genesis or some of the other things that stimulate collagen. It's really the deepest thing that we have to go into the skin to stimulate and make our collagen grow. Because as we age, we start losing collagen because it's breaking down and our body isn't producing as much. And so that's why it's so important to do treatments that stimulate collagen. So the Ultherapy, again, as I said, I do it every single year. I caution people because it is a little bit uncomfortable. It's not painful per se, but it is definitely a little uncomfortable. So the first 4 times that I did it, I really didn't have any kind of medication with it, and I managed to get through it. But then we realized that just making people relax a little bit helps them get through it. So that's one of the things that people are afraid of because, like I said, it is a little uncomfortable, but not painful. So the medication definitely helps to relax and you get through it faster and easier. There are 3 different depths that we treat when we're doing Ultherapy, and so that's why we still need Ultherapy, even though I'm going to tell you all about Secret. We need the combo is, I think, what's going to be key. And and by the way, if Nicole's in the picture, this is Nicole. She's my assistant, and she's pulling up some photos because I want to show you my photos over the last years, but we'll get there in just a second. But when you're talking about anti-aging and you're talking about actually maintaining, you want to hit the skin in several different layers, and again, Ultherapy is going to be our deepest. So Ultherapy once a year, it's a little bit uncomfortable. There's absolutely no downtime with it.
It takes 6 to 9 months to see your max effect. So I always like to let patients know to be very patient with it, and so we will track the progression with you. But it is a slow process for the Ultherapy. So that's where we take your photos. Usually at 6 weeks, we usually will do 3 months, 6 months, 9 months, just to keep track of your progression for your Ultherapy.
Right, and technically it'll last up to 2 years, but we like to do it at the year mark because you're really stimulating the most collagen by that year. And so we don't want the collagen to stop growing or stop being stimulated. We want to continue that on. So that's why we we recommend doing the Ultherapy again at the year mark. So then Secret RF is one of our newer procedures, and I tell you what, I'm in love with this procedure. And let me tell you why, because there's so many reasons. But probably my favorite reason besides results, because I haven't seen the results quite yet because it takes up to 3 months to see them, but the best reason is that there's no downtime with this. And I did a video, I think Steph posted it, was that yesterday or the day before? Yesterday, just showing my day after all of these treatments and how minimal redness that I had, and I put a little even up on it and covered it beautifully. And what was funny is I said in the video that I was going to only do half my face and then go the whole day with just my half the face. So every patient that I saw, I'm like, well, sorry I look so funny, and nobody even noticed. Yeah. No one noticed at all, and it was so funny. So I'm like, no, look, this side is a little red, and they're like, no, it really isn't. So that's the beauty of the Secret. I think that's really what my favorite part is, that there aren't any results, there's any downtime. There are lots of results, but nobody wants downtime. I don't want downtime, and so that's really important. So as I said with Ultherapy, we're going a little bit deeper. into the skin. The Secret doesn't go quite as deep, but you're hitting still 2 of those layers of your skin and making the collagen stimulate. And if you've heard of microneedling before, I like to say that it's microneedling on steroids. And when we have our typical microneedling, which we've done, 4 or 5 years now, probably microneedling.
Probably going on 5 years.
Probably 5 years. And
yeah.
I love microneedling. We see amazing change with microneedling. But the microneedling, we only have 12 little needles, and with the Secret RF, we actually have 64. So you're getting a lot more bang, I feel like, for your buck. And also, we're doing full face, neck, and chest
you're
for
covering
Secret.
much more of a surface area with the Secret RF as well.
So I think it's a much better treatment when we're doing it. Not to say that microneedling isn't great, because we still love microneedling, and there's different price points, obviously, with these. And I still think microneedling has its place. But when we're talking about microneedling, and then of course the Secret RF, which is the microneedling, a little bit souped up, is that you are you're creating little micro injuries in the skin, and then the skin is healing itself, and that's how the collagen is stimulated, because the skin is saying, hey, I better figure out what's going on here, and I'm going to heal myself. And that's the beauty of it, is it's your own body creating the collagen. So let's talk Secret RF. We do monthly. You want to start with 3 treatments. Now, if you have deep lines, acne scarring, you have some other things going on besides just little textural issues, little fine lines and wrinkles, I'm going to recommend 6 treatments. You're going to do 6. Maybe you do 3, wait 3 months, and do another 3. But you have to think about this, that the deeper it is, the more treatments that you need. But the majority of patients will start with 3 treatments. And what we're seeing is that patients are saying that they're seeing a huge difference with neck and chest. And I think besides surgery, that's the hardest area to treat, because you just can't get, can't put filler in there. You just can't get those really tight skin results like a surgery can do. So when patients come in, one of the first things I ask is, are you opposed to doing surgery? Because really, to get the best lift non-surgically, yes, you're actually going to pay quite a bit of money, so you may as well think about surgery. And if you're not there yet, that's okay too. Then we start going into all these other options on how to tighten the neck. So you've heard me say a million times, I always start with skincare. So our growth factors stimulate collagen. So when you're putting your growth factors in your face, you also want to put a pump down on your neck and your chest. And that's going to help to stimulate that collagen and make the skin look better, the texture look better, the skin tightening. Now, is that the end all be all? No, you're not going to see 100% change with that, obviously. So you have to do some other treatments, and that's where Ultherapy and Secret come in. What else was Secret? No downtime. We established that. We just started it, so we really have patients coming back for their first or their second and I think a couple of patients in their third.
Getting their third treatment in. So we're going to track their progression. We're going to see them in 4 weeks from their third treatment, take photos, follow up from the beginning, and review their results with them. So we're really excited to see our clinic before and afters.
Right, because the other doctors that, we have a lot of before and afters, but I don't believe them until I actually have them in my clinic. And I would say that everybody that has been in that's had 1 or 2 treatments is already seeing results, and especially on the neck and the chest. So this is an excellent treatment for the neck and the chest, and you get the bonus of the face. Usually it's the other way around. We say, okay, we're treating the face, but you get the bonus of the neck and the chest. So I think that this is, I love it. I'm really in love with this treatment. So let's take a look at my photos.
So what I did is I actually wanted to pull up some older photos for her. And so you might, I don't know if you might have to zoom in a little bit or come forward.
See what you think.
But what I actually did, so Dr. Jacobs does Ultherapy every year. So this is actually 2016. This is
come down as close as you need to.
As close as we're really looking at her jawline here is what we're looking at. And so what I like to pull up is some older photos. This is 2016. This was 2018, and actually this was just last week. So look at over the years how much defined her jawline has improved doing Ultherapy every year. It has gotten better and better each year, and that's why we recommend Ultherapy yearly, because we're building on that foundation of new collagen.
And you said 16
18 and 19.
So I'm 3 years older here, and my jawline
Mine
actually looks so much better. Wow.
It's a huge transformation from here to here, and just seeing the progression year to year, you're still getting that nice improvement and better results each year. Even looking at her brow, so we're looking at her lid here, right on that upper brow bone, and even as each year it's gotten higher, her lift in her brow from her Ultherapy. Even like if you look at this fold here, it's gone. You don't even see it anymore. That's how much lift she's gotten over the years from continuing her Ultherapy as well. And
look at under the eyes.
Under her eyes is a huge improvement as well. So let me even...
before you do that, let me just remind everybody, this year, it's been 2.5 years since I've had filler. So there's no filler going on here. This is truly skincare, Ultherapy, and Botox. Of course, lots of Botox. Always have lots of Botox. But besides that, there's no filler. So, I mean, these are super impressive. So 2.5 years ago... I would have had filler in this one. You said that's 18?
This is December of 18. This one maybe. This was 16.
What month do you know?
I want to say it was June of 16.
Okay.
6/16 is what I pulled up.
6/16. So 17, 18. So I wouldn't have had filler there.
No, because I think you had it in September of 16.
It was February,
okay.
but I think it would have been of 17.
Yeah.
February of 17 is when I had filler. And so really, like I said, I mean, to me, this is extremely impressive. I'm 3 years older, but
and this is a very realistic expectation for Ultherapy. That's a great point that I like to make, is the expectation with Ultherapy. It is not a facelift. We are getting what we're treating at the depth of what a facelift is reaching, but you're not getting it's not a full facelift. We're getting tightening, lifting of the skin, but I always like to reel those expectations back a little bit, just to this is a very nice change, but it's a very realistic change as well.
And think about it, you forget what you look like. So if you would have asked me, I don't know that I would have said I feel like my eyes are lifted or my jawline, because as we're getting older, and I just keep thinking, man, I need to do something. Sure. And so I think you might not notice the difference until you see those before and after photos. And as you can see, ours are very standard. We use the same lighting, the same camera. Nicole is the one who takes most of the photos, just because we need training, with everybody else. But we really try to standardize everything, because you can change lighting, you can change angles, you can do a lot of different things to make photos look better and better. But really, we want to have amazing results, and so we try to standardize it all. In those photos, I could see a little bit of textural changes that were not better in this area, but I also think I was dehydrated, which is why I did the Hydrafacial beforehand. So I bet if we took the photos today and added those to them, I bet there'd be even more improvement, because just without my even up on, my quote unquote makeup, without it on, I can tell a difference in my skin. I feel more hydrated, and I feel a little bit tighter. So it'll be really interesting to see in 3 months for sure. We'll take photos again.
Yeah.
And I know I did the Ultherapy in December, and we pulled January. We pulled them just a month out. I don't remember exactly what I was doing and why we pulled them, but we could see a difference at that time. But I think what people have to understand, what you have to understand, is that everything works together, and there's nothing short of a miracle, besides a facelift or a neck lift, that is going to give you this instant change. It takes so long to see results, and I think that's the most important thing when we're talking about skincare and these particular treatments. But I still recommend skincare, collagen stimulation, and then our injectables are going to be our quick fix. We're going to see more change faster with Botox, and then with our Juvederm fillers. And then, of course, nutrition plays a role in this too, and you've heard me talk about, hopefully, and if not, go back and get some of these other videos. You can actually find all of our live videos on YouTube, or scroll through the Facebook, but the Facebook page, so I don't sound so old. But the microcollagen is extremely important, but when you're talking about microcollagen, you just can't go to the grocery store or Walgreens or whatever and get microcollagen or collagen. You have to have the right size molecules. You have to have the right product. Same thing with your vitamin D, with your multivitamins, really with any vitamins. You're just not getting the quality that you need and deserve at Walgreens. So we have more?
Yes, I wanted to change the view, and I couldn't get all three of them to pull up, but I wanted to pull, this was December, and then this was June. So this is 6 months later. So this is a 6-month result on her Ultherapy, as well as I'm kind of bringing in Thermi Smooth. We actually are really focusing around her eyes. The amount of lift that she has is tremendous when it comes to her brows here, but looking under her eye, she had I think it was a series, I think it was four treatments of Thermi Smooth, and that kind of played a factor as well, because we see so much improvement under her eyes.
Well, and I also think I started Total Eye.
Yes.
The color science Total Eye, and so I absolutely know that Total Eye can help under the eyes, and that's the part that I'm even today, like I'm looking in the mirror going, oh, under my eyes, but when you look at this, there actually is great improvement.
Combination therapy is very key, because when you do just one thing, you'll see some change. You'll see change in whatever treatment, but when you start doing combination therapy, that's a huge factor with adding your products, adding your treatments, adding in other services in the clinic. That just takes your step to another level. I apologize that I have eye makeup on this one. So again, we'll take photos again, because usually we shouldn't have that if we're really being, let me borrow this for a second, but if you're really doing it as a standard photo. But what we're talking about here is you can see the line here, that's my upper brow. And then you can see how much it's lifted there, because you see more of my upper eyelid. And same thing over here. Now, if you notice, this eye is always a little higher anyway, and you can see it in here too. But the funny thing is I had a little bit of a Botox droop the last time I had it. So what's so impressive is that I have a little droop, and I think it was this eye. It was that eye.
Yeah, so it was actually this eye, and how impressive is that it's so lifted. But I think, the little bit of a droop is gone anyway, but that's reality. Sometimes that can happen. Right. So I love these photos because you can see what a change there is. And I always say, because we have some of my eyes hanging in the room, and I always say I didn't know that I needed an eye lift until I see the change with Ultherapy. And possibly and Thermi. So we threw Thermi in there, which I didn't mention that in the beginning. That's another way to stimulate collagen. So the beauty of Thermi is, one, it doesn't hurt at all, and you can go all the way around the eye. So you are getting some nice collagen stimulation underneath here. And truly, I'm not saying you have to do all three of those modalities, but each one does a little bit different. So you have to figure out what's best for you. And one of the things that I always say is that you have to figure out what your goals are. So what really do you want to change? What really do you want to improve, I should say? And then what's your lifestyle? So Thermi, this is a good point about lifestyle. Thermi, you have to do 6 treatments to see change. Ultherapy, 1. So I said, Ultherapy is a little bit painful or uncomfortable. Thermi is not at all. So which one is going to work better with your lifestyle? Me, I'd rather take a little bit of the uncomfortable, do the Ultherapy 1 time. As I just said, you're supposed to do 6 Thermi. I made it through 4. I see the results. I think they're outstanding. I saw them as I was doing them, so I really need to get my hiney back in here and get some more Thermi done. And then the other thing is budget. So we look at that as well. So goals, lifestyle, and budget. And you have to pick and choose what works well in all 3 areas. And I will continue to go back to start with skincare. And then quality skincare, obviously, not just any kind of skincare at all. Something that is going to tell your body to change the physiology of the cells. So the collagen stimulation, the hyaluronic acid production, retinol. There's so many things that not that you need them all, but there's so many different ways that you can do this and see the results. So what we do is we do a treatment plan, and we figure out what's going to be best for you. because something that's good for Nicole might not be good for me, or something that's good for me might not be for her. Obviously, she's way younger than I am, and so she doesn't necessarily need the Ultherapy
or the Therapy, maybe. And for me personally, I am very religious with I'm very big on my skincare. Around my eyes would not be my first area that I would focus on. So that's exactly kind of like what area might bother her, maybe a little different. So we really customize with what your goals you're trying to achieve, and for me, mine is my forehead wrinkles, and so that's where my Botox and my skincare and my complexion and my brown spots. So I am very religious with doing my Even Up every single day, which is one of our color science products, using Lytera every single day. That really treats the brown spots that I'm trying to correct on my skin, because that's a concern for me. And keeping my collagens, I want to look as young as I feel. So I'm in my 30s now. So for me, so I'm in the 30 club now. So for me, I feel like time is ticking, and I want to continue that prevention, so I'm not getting the lines that I could have if I did nothing when I'm in my 50s. And so I definitely want to make sure I'm taking the steps to keep my collagen stimulating, because as I'm 30, I think it's the age of 25, your collagen starts depleting after 25, or slows down.
It starts
and so I want to keep that process going. So I really do contest, and I use my skincare every single day, and I've used it since I've started here.
Which we're going, 7.5 years?
We're at 7.5 years.
Yes,
so
yes. So I know I get to keep her forever because she doesn't want to look old. So
right,
it's easy as that, right?
Yes. So that, everybody is very different, and we want to customize it to what you want, what your lifestyle budget goals are, because every treatment is very different for each patient. So,
and I love that you said prevention, because a lot of us come in our little bit later years and say, okay, fix it. Well, we can, but then obviously it's going to be a lot more. So a lot more different products that you have to do, because you have to now look at your fine lines and wrinkles, your brown spots, your redness, the texture.
Yeah.
Texture is really important as we age. So you might have to have 4 or 5 products. Not that you have to, but we might consider 4 or 5 products, versus if we would have started earlier
and just start with 1 or 2 or 3.
Right.
So
and then the I was on a good train, and I forgot now. Prevention. So the earlier you start, the easier it is to maintain, basically. And when we talk filler, you add at least 1 syringe every decade. So when we're in our 50s and we're in our 60s, you need 5 syringes, 6 syringes. And that's not the hard and fast rule, but that's definitely something that we look at and think of. And so people are so afraid when I say, oh, you need 4 syringes. That sounds like a lot, but 5 syringes is actually 1 teaspoon. So it's not a lot of product that we're putting in, and it's all about putting it in to look natural. And again, 4 sounds so scary, but really it's not. Well, it is kind of scary, but it shouldn't be scary, I should say.
Right.
So, okay. So I think, do you have any other photos that you want to share?
I think that address, because I know we really wanted to look at the eyes today. We really wanted to look at the jowl.
What about my upper lip lines? Because I thought you had said that you saw some change on the upper lip lines, because I think that's important. That's really what we've been using the secret for recently, because that's a part, everybody hates it, even though they don't smoke, they have these smoker lines, and so they feel like that is a place that they want to treat. You can do filler there, but I really feel like collagen stimulation is going to give you better results than, in filler you need that too, I'm not saying you don't, but the collagen stimulation is what we...
So I'm really zooming in, but even looking at, just overall texture, everything around this area is much softer. I feel like it's kind of blurring.
Can you see that? Yeah.
Yeah, I feel like it. And I don't know if this photo is not... I don't know.
Yeah, actually, the place, let me see your pointer.
Yeah.
The place where I can see the most change is right here, and I don't know if you can see it through the phone, but right here you can definitely see it's lightened up a little bit. I think what's interesting is, because I haven't had my lips in 2.5 years, so that's interesting that, you know, there really isn't much change there, which is good. I really, really want my lips done soon. But you can also see right underneath here.
Yeah, that's a nice
some lift there. Some lift through there, and I think some tightening through here, but very subtle changes. And I think that's a good point that you made earlier, that this isn't a facelift. We're not doing this to your skin.
Right.
You know, we are really doing some fine tuning.
Yes.
So I think that those photos are great. Thanks for being on the live show.
Thank you for having me. Yes.
So if you have any questions, any comments, please don't hesitate to give us a call at 618-288-9117.